Welcome to my following topic, organ language and palliative care. It is a great wish for me to express an enormous gratitude for the nursing staff, the physician, as well as all those involved who work tirelessly with faith, enthusiasm, a lot of effort and motivation for the people treated in the palliative care departments. It is exhausting and, for the most part, tiring to work with patients who are no longer returning to life and, in this sense, the service provided do not have a positive outcome. The nursing staff must also be able to deal with this circumstance. The focus is not, as usual, on life support, where every support is a success, but the service is much more aimed at a facilitating end, as the dying, and is therefore often not fulfilling. We, humans, are conditioned to regard life as well as every life-improving measure as promising success in the sense of life experiencing. Death very often represents the failure of a doctor or nursing. Therefore, this confrontation with palliative patients is often challenging and requiring for the nursing staff. Unfortunately, often the common awareness is that palliative care is often not of help focused on living but on dying. In general, patients are treated palliatively when medical treatment options have been exhausted for them. The palliative care, the causes of the disease, perspectives for a cure, neither physical nor psychological are pursued. Relief of pain comes first, which often involves strong sedating painkillers. Patients are often kept in a state of indolence, passivity, and comfort with a focus on dying despite the highest level of care. This is often because patients have given up hope. Organ language enables understanding of being sick from the cause to one's own participation and co-responsibility. The patient gets the chance to consciously relieve his pain by understanding organ work, by using his mental powers. Organ language has a meditative and clarifying effect as psychosomatic connections become conscious. Already the statement or even prognosis of the short life expectancy, which are still made by laboratory values, diagnosis, the white doctor's coat, struck patients to the core and leads its brain function on dying. Like the animated, embodied personality of the human being, which dissolves their being more and more with such statements. So you may ask, how does organ language help in palliative care or the dying patient? How can organ language relieve pain or suffering? At the end of this presentation, you will be able to perceive, like an eagle's eye, how much relief and peace, how much healing power and blessing is possible and selectable for the highest good of the patient. Similar to hypnosis or meditation, patients gain an understanding of larger connections and participate in the final journey of their liberation. The conscious liberation of the soul from the body through a more conscious understanding of larger psychosomatic connections and acting on the organs distracts from the sensation of pain and empowers the patients to conscious action. Spiritually, it is known that the detachment of the psychic body from the physical does not take place properly under anesthesia. Esoterics speaks of an insufficient detachment process when dying under anesthesia, which requires a new incarnation and often as a newborn, just to complete the detachment process of the last incarnation and die in peace. Because every recurring thought, especially of worry, fear, anger, uses elements like minerals, condenses into matter, and finally stresses and affects the blood circulation and the rhythm of life. In this sense, organ language offers the chance to recognize the harmful thought structures, transform and thereby accept its pain in the present, transform and, if irreversible, to detach more easily from the physical presence. Energy body and the triumvirate body, mind, soul. The highest goal of the soul is the development of its evolution. The body and spirit are servants of the soul and material expression, where everything can manifest, show itself. The spirit directs the matter. The soul is the feeling, the emotional energy as a driving force, like horsepower for the vehicle, the body. Like the horses represent the attractive power of a carriage. The soul always makes a decision to express the most beautiful and highest vision of itself. When the soul realizes that due to conditioning, programs, limitations, norms, cannot experience its most sublime form, the most beautiful expression, its freedom and its ideas, it considers leaving the body. Illness begins. Relatively, the mental work on an imminent accident, with corresponding consequences as expression of the limited or prevented soul expression as moderate injury, handicap, or dying. The triumvirate, body, mind, soul, represents a unity. If a human being is dying, then the soul has made a different decision than his body and spirit. The Earth's residence does not agree with the experience of the soul anymore, so therefore it seeks a detachment from the body. Man identifies himself through his body, but also through the spirit. So, when problems occur in the body, man strives to put this vehicle in order, like a mechanic fixes the car. The chronically ill person is unable to make a decision. He concentrates on the sensation of his body, his pain, which demands from him soothing, freedom from pain. It happens much more often that terminally ill people, at the last moment before they know that the end is near, make the decision on the level of the soul to stay here on earth and to continue living. Because something unexpected has changed or a new passion has been awakened, that the energy of the soul animates the body again. Through painkillers and suppression of inner sensations, and therewith cause distraction away from this energy of the soul, the thought cannot consolidate strong enough to change the autonomy of the body for preservation and sustainably maintain. Nevertheless, some people make the leap from the death sentence and remain here on earth to the power of the soul and a strong desire, like a miracle healing, and continue living, because they have understood the cause, the reason of the illness, and finally experienced on the soul level that they can continue the life and develop here in the body. Consequently, they remain incarnated for the time they experience their passion and freedom. For the outsider, it looks like a miracle healing. The most difficult thing for a human being is to hear the voice of the soul. The organ language leads to the recognition of the triumvirate, body, spirit, and soul, and thus to the recognition of the destiny of man. In this triumvirate, the desire of the soul is grasped and can be modified or adapted accordingly by decision of the spirit and the body as servants of the soul, with regard to what the soul desires to experience. The result can include the decision of perfect healing or die, which, however, is done consciously, peacefully, in agreement with all energy bodies and without pain. In this way, it is possible that the soul's urgency to leave the body in favor to have a more alive, joyful, forwarding, liberated experience through the insight and consciousness of the body and mind can decide to start a new joint attempt. As a result, to create their most passionate experiential desires on soul level with and through the body-mind vehicle. This decision would mean continuing to live and enter into a new experience rather than experiencing freedom by leaving the body, which would mean dying. Some people who receive a fatal diagnosis decide to change their life completely, to sell their house, to move far away, to leave their job and family, and to have a completely new life experience, knowing that they will die soon, to finally return after a few months completely healthy. This is the experience desired at the soul level, which has hurt by the body-spirit. Therefore, it is important to understand the language of the symptoms, not to interpret them, but to perceive them attentively. What is the disease forcing me to do? Which body part is affected, right or left side? What would I think in the same situation without the disease? How would I behave without the illness? Who does this serve the most? And if the pain, this disease or cancer is my friend and wants my highest best for me, what does it want to communicate to me? Addressing symptoms as welcome soul signs of your body language help identify, process, and resolve deeply rooted attitudes, conditioning, blockages, and so on. Energy medicine tries to understand the living being, human, animal, plant, in its entirety as a physical and ethereal creature, as body, mind, and soul. Today's scientists can measure the barely perceptible but existing energy fields in and around the human body and know how they are generated, and that the energy fields change during illness and disorders. Because illness means, first of all, a disturbance of the energy fields, since the natural energy flow is disturbed. The material body, the physical body, skeleton, bones, muscles, the emotional body, heart, hormones, circulation, energetic circulation is the burning system, the digestive and sexual organs, mental body, brain and nervous system. The spiritual body includes immune system, meridians, energy, light, and chakra energies. In finding the cause of an existing or even persistent disease, that chart is relevant. For example, people with problems of the immune system, general energy fluctuations such as performance disorders, lack of concentration, fatigue, exhaustion, concentration disorders, colds, gastrointestinal infections, chronic disease are asked to pay more attention to the spiritual aspect and to make necessary transformations. An immune disease finds its cure when the spiritual aspect is lived, expressed, and transformed in daily life. The different levels of consciousness. The physical level with physical pain, organ malfunctions, surgical interventions, unchangeable tissue. The psychic level of our mind, mental forces. The mind, our thinking, controls all physical cellular functions. The soul originates, the mind creates, and the body experiences. A disease is the extreme, violent expression of a constantly wrong mind course, which even leads to a generation of organ functions and tissues. Everything is in balance, in the perfect doses, in the flow of time, balanced in the blood system. Example out of my praxis. 61 years old female patient diagnosed with stage 4 ovarian cancer. The diagnosis showed large gallbladder stones, large renal cyst on the right with an extension of more than 6.1 centimeter, ascites distributed in all 4 abdominal quadrants, liver metastasis, thickening of the peritoneum, left ovarian carcinoma, infiltration of the right ovary, degenerative change of the lumbar spine, and hiatal hernia. A PET scan performed elsewhere showed a tumor infiltration of the colon. In this state of cancer metastasis, the patient was given a life prognosis of approximately 6 months. In stage 4 ovarian cancer, all conventional medical measures are considered palliatively only. In this case, surgery, chemotherapy, and radiation were not performed. The recommended palliative measures included mistletoe therapy and following symptom treatments: extremely enlarged abdomen, back pain, weakness, stomach pain, flatulence, nausea, restlessness, insomnia, digestive problems, and allergic reaction to almost all foods, loss of appetite. The medical prognosis and life expectations weakened the already struggling patient, and she buried any hope for continued life. Lack of energy, forgetfulness, very raspy voice, constipation, depression, inability to dream is a sign of the adrenal insufficiency. Often so tired that she could leave the bed only for a few hours, but also the strong desire to rest moved her husband to make another attempt to improve her condition for the last months. The patient, now tired of life, accompanied by her husband, visited my office to receive an adjunctive therapy for her symptoms. But the patient spoke more and more of terminal care. For therapists, doctors as well as caregivers and relatives, when working with cancer patients, are often affected by patients unconsciously because of drawing a lot of energy from the caregiver, relatives, and so on. Essential fears, losses, facing death are energy beings that feed and rise from the other energy sources. It requires neither strength, nor wisdom, nor training to give in to unkind, destructive, negative impulses. Chronically ill or cancerous people are more sensitive and therefore more vulnerable to give expressions to these unrestrained emotions. Illness makes honest. As humans, we all are familiar with fierce feelings of powerlessness, doubts, or mood swings, and therefore we resonate with these cancer energies. The greater the fear of dying in the concerned person, and the more the disappointment is through the own illness, the more the cancer patient needs and draws energies from others. It is not unusual that the caregiver companions are often weak, pale, and exhausted after a session. When I saw how the patient's husband became paler, and I should risk an emergency call, I reminded the patient to decide instantly about your desire for living consciously and committedly until her passing. This includes working on all the issues that cause this disease and this aggressive metastasis. The goal should be to understand and surrender whatever is meant to happen and to accept it with trust. The loud boom of a sudden explosion shocks the nervous system of a near listener and shatters the cellular constitution, the cell structure of the body. In exactly the same way, it shatters, disturbs, and confuses the flickering vibrations of irritated feelings, the finer stuff in the atomic structures of the thoughts, the body and the world of the person who emits them, whether consciously or unconsciously, intentionally or unintentionally. Dissonant sensations produce conditions which in the world of human experience is called disruption, aged, weakness of memory, failure of every kind. Giving expression to maladjusted thoughts and feelings in the path of least resistance and the habitual activity of the conditioned, duty-driven individual who has fallen into self-pity, who refuses to understand the law of his own being and to bring his personal self, which is only his medium of expression, so far that it follows his joyful soul experience, must struggle with symptoms. The cancer cell is not evil, nor is it the enemy. Cancer is the attempt of the body to increase the surface area of the body in order to be able to secrete even more physical as well as mental acids or toxic substances. Dr. Med Kuzmin, Catherine. The affected organs or locality explain the physical as well as mental backgrounds concerning the development of cancer in the body. The patient decided to work with me on her life's work body. The color in her husband's face returned back. Basically, as humans, the death of a loved one represents a loss accompanied by deep grief. The physician or therapist who strives to keep his patient alive sees the death of a patient as a failure. Often questions remain of what more could have been done. Of course, all of us humans are generally oriented towards preserving life. When patients experience a state of resistance to therapy, such as palliative patients, it's often important to work out the remaining time of his traumas, mental injuries, the spiritual discord, past injuries, disputes, regrets, unfulfilled wishes, consciously, so that a psychological as well as spiritual detachment can take place. In any case, there should be no procrastination of life issues as toxic emotional cadavers under anesthesia by painkillers. It is clearly seen when people leave this earth in peace rather than with a feeling of being punished with a disease that has simply afflicted them and represents a great powerlessness for themselves and their families. Or creeping out of life under painkillers without being able to detach themselves in peace and from their loved ones in a clear mind. In fact, the disease, as a demon, should not be fought but accepted as a corrective sign of this life, utilized and corrected, if possible. Sometimes a patient heals from the predicted terminal disease, and then it is called a miracle cure. and other patients get more time than they predicted and settle all their concerns here on earth and can let go of life without painkillers in full consciousness, leaving behind people whom the peace of their passing away relative gives a good feeling of the change of life into other spheres. The organ language, in addition to the understanding of organ functions and organ tendencies, also enables to recognize which distinctive states the respective organ have tried to express. Besides functionality, organ language also takes into account the psychological influence of the mind and organs and vice versa. What should the liver detoxify if the person's mind sees only toxicity, is distrustful, frightened, and sees life as a constantly hard struggle? How should blood cells as life source giving power start their great journey in the body if the insufficient self-love does not motivate them to live? How should the immune system train its protectors and policemen if every statement expressed and heard is perceived as a criticism and disapproval? Already in the first appointment, we were able to work out in rough steps what had happened in her life. The patient had completed her studies as a teacher in a foreign country, came at the age of 48 as a committed, joyful teacher in a school system that was initially foreign to her, and was able to assume a school class within a short time, due to her reputation by students and parents. Within one school year, this class developed very well. Parents praised the new teacher. The colleagues, however, were very envious. In order to keep the staff calm, the director demanded my patient to perform more administrative work and to adapt her teaching methods to the resident teaching model. Due to her many years of experience as teacher, she developed quite an efficient working style and was able to maintain her classwork. Unfortunately, this was not welcomed by her colleagues and school management. This ill feeling in the school building and clear exclusion of her person during breaks, events, and other school activities put a lot of stress on the patient. In the clarification meeting with the school administration, she was offended, demoted, and threatened with dismissal if she did not adjust. As the main family earner, this was an existential threat for her. This mobbing blocked the patient from expressing her creativity, her joy, and led to more and more discomfort, both at work and at home and in her body. As the success of her classes continued and more parents praised her work to the school administration, the pressure on the patient increased. More and more joy, energy, creativity disappeared, and finally, every morning at school became a painful firework. This went on for several years. She treated the physical symptoms with remedies, sometimes even stronger painkillers. The greater the rejection by her colleagues and the school administration, the more she tried to take over more duties, tasks for her colleagues so that she could create a good atmosphere. This was very often at the expense of her marriage and children. The patient had to visit the doctor more often. Morning sickness, stomach pain and burning, digestive problems, insomnia, increased hair loss, which confirmed the hyperthyroidism, and the diagnosis of burnout represented her situation. For hyperthyroidism, the patient was given antithyroid drugs, known as thyrostatic drugs. Thyroid dysfunction of all kinds has a profound effect on ovarian function and can lead directly or indirectly to ovarian insufficiency. Thyrostatic drugs are iodization inhibitors and have an inhibitory effect on the conversion of iodide into its effective form, iodine. The psychological function of iodine is not feeling nourished, not feeling loved. When iodine cannot come into action in the body because of facing feelings of rejection, intolerance, hatred or condemnation, iodine accumulates in the body. It cannot be converted through the many areas of the body, brain, bone, and hormone metabolism, etc., into energy, into self-love, and finally into self-maintenance. Humans need iodine for very many development processes in the body. For example, nerve cells, for the state of mind, synapse reaction, brain, pituitary gland, and hypothalamus, the vegetative nervous system, also the hormone system, thyroid gland, for the cognitive abilities, the energy metabolism, and so on. So, because she was dependent on the salary and did not want to let the students and parents out, she did not obey the signals of her body. Her body didn't recover much when she resumed her work. More years passed this way, medication instead of inner reflection. The director terminated the patient's employment shortly before she took another sick leave at the age of 57. This led to a court case that dragged on through several months. The patient found only temporary jobs to support her family and children who were studying. Such an unfavorable and disease-causing situation never happens only one-sided, like, for example, the colleagues, the boss are stupid. No, both sides resonate and serve each other. Often, this is a repetition of a previous similar situation on a different level. The powerlessness, anger, rage of the patient, materialized emotions as gallbladder stones in this situation are clearly evident and even understandable. She has lost her joy, creativity, soul passion, the sense for her work, the living out of her talents with students. Her self-criticism sparked anew and she felt no longer good enough. This extreme pressure and tension through the years create chronic, toxic and unrelieving stress in the body. Stress produces high release of adrenaline, which is corrosive to blood vessels, tissues, organs. Increases the concentration of ammonia in the blood, which among other things leads to unfavorable formation of hydrochloric acid in the stomach. Therefore, after adrenaline release, the body produces cortisol to repair what adrenaline causes. However, cortisol not only depletes liver reserves such as glucose, glycogen, and iron, but also depletes other organs such as the pancreas, ovaries, thyroid, and so on. In addition to hormones, the ovaries produce tiny ovules from which a human being is created. That is why the ovaries are said to have the greatest energy of creativity and joy of life. If a woman loses her creativity and cannot live out her joy of life, this is expressed in the representative organ, the thyroid gland and ovaries. The thyroid gland, similar to a butterfly on the sensitive neck area, shows the sensitivity to the outside world, but also the unfolding ability of the personal activity in the world. A predator almost always attacks the throat of the victim. In this way, we bear our thoughts to our employer, who may hold us hanging from the gallows with our wages. And quite often, the employee sacrifices his creativity, strength, and joy in favor of a secure salary. The anger, displeasure, disappointed creates acid toxins in the body. In addition, the patient uses chemical acid-forming drugs as additional damaging substances against pains. The glands, such as the pancreas, the ovaries, the prostate, and also the lungs, are the finest, most delicate types of tissue, similar to living tender sea corals, which are hardened by acids. Their function is reduced as a result. An important aspect is that ovarian cancer is a secondary one. This means that another type of cancer, breast, peritoneum, stomach, colon, was already in the body at the development stage as a forerunner of ovarian degeneration, similar to a catalyst. Our organs are the most generous lenders and borrowers. Organs live in a large social community through a self-organized dialogue. Each organ has its function and expression. For instance, the stomach is the father of well-being, also called the reservoir of tears. The gallbladder is the organ of expressing anger and thus of deciding emotional character. The liver is the organ of mortification. The small intestine represents the analyzing, censoring, evaluating function of the digestive tract. The lung is the organ of communication, exchange. In the Asian medicine expression as follows: the anger of the liver is the grief of the lungs. This interlinked perception of mental action and physical reaction gives the possibility to understand how injustice, offenses, anger, rage, discomfort, first mentally and then physically condense and accumulate in body as toxins, harmful substances in the corresponding organ. From the various readings and books of Lotta Hirneise, Dr. Med Rüdiger Dahlke, Professor Dr. Med Richard Bellivio and Dennis Gingras, Dr. Cosmin Catherine, Edgar Casey, and so many more, I discussed with the patient her goals and the next steps. Since chemotherapy, surgery, or radiation were not a choice anyway, thanks God, she decided on a naturopathic approach. Mr. Lotta Hirneise represents in German the 3E, that means nutrition, detoxification, energy work. The patient had been living vegan for several years. With the bullying at school, her unexpressed anger and frustration often demanded smoked meat or cheese. This often occurs when there is a high level of accumulated anger or rage that one would like to tear the meat of the bone with their teeth, to express their anger at the bone. Hence, the diet could easily be reverted to vegan foods, and in my practice I developed special programs for various forms of disease, as the everyday diet should primarily provide sufficient minerals and vitamins. Other nutritional supplements were adapted, especially the organotropic Schüssler salts. The biochemical salts of Dr. Wilhelm Schüssler, so-called biochemical functional agents, reorganize the metabolic balance, because disease of the cell arises from the loss of these minerals. The biochemical functional agents are particularly depleted by unfavorable stressful states of mind. Schüssler salts also affect the psyche, the mood of a person. The focus should be on energy work and detoxification of the physical body, supportive also by dissolving the mental toxins, thereby enabling the processing of life issues that had caused this condition. For this, the present symptoms, the language of the organs, are significant. The extremely enlarged heart belly, like be pregnant with anger, resentment, anger. Back pain cross. The burden of life is hard to bear. Weakness states. Feeling of powerlessness, any action seems hopeless, with no potential for improvement. Stomach pain. The father of well-being has exhausted all options for the creation of the happy soul experience and cannot absorb any more unshed tears. Flatulence, of gassing by the emotion cadavers that have become toxic. Releasing the pent-up resentment that has been sitting inside. Extraordinary bleeding, sacrificing one's own life essence. The uterus bleeding as a symbol of bleeding of femininity. Strong weight loss, dissolution of personality, loss of own identity. Incisive pain in the abdominal area. Abdomen represents the center of social life. It is the granary of life in which a sword fight takes place. Like the director against her. Allergic reaction to almost all foods. Fear of further unknown attacks and injuries. The working wage was the financial food which demanded a lot from the patient and became toxic for her. Loss of appetite. First, abundance of unprocessed mental situations. Second, distrust and refusal to take in foreign information. Third, refusal of further processing and digestion of information. In the first session, we created a work plan, initially with the aim of understanding the causes of the diagnosis and clearing them up as far as possible. We discussed further naturopathic therapy methods of cancer treatment. Finally, in addition to physical and mental work, the patient decided to receive a turmeric infusion therapy in a clinic qualified for this with the support of her trusted doctor. During the treatment periods with turmeric in the clinic, we processed the psychological aspects and directed the mind to positive, enriching, prosperous areas of life. In the course of months, the patient was able to put behind her various previous life situations with losses and emotional injuries. She made the changes that were right for her and the family. Step by step, the patient trusted herself more and more to her new life flow and life rhythm. The patient processed many painful, unresolved issues of her past. In one hypnosis session, she saw herself sentenced to death by a judge in another incarnation for helping an outlaw community. She recognized in the judge her former school director. More and more, she recognized connections and the related processes of detachment through forgiveness. She felt the self-empowerment to let go of her past, to live through traumatic experiences with gratitude and to take the gifts out of them, to be able to create new thoughts and the feeling effect of her thoughts and actions. Her perspective changed and gained zest and courage for life. This is a quote from Albert Schweitzer. All people carry their own doctor within them. They come to us without knowing this truth, and we are most successful when we give the doctor that is in every human being the chance to function. Certainly 60 years of a lifestyle cannot be changed that quickly. It is not about giving people in palliative care hopes for healing, even in the sense of physical recovery. It is about giving them time to extract important knowledge from the disease and to understand why a disease could have developed in this form, because this knowledge explains the mental state and as such the sickness. The knowledge that we can heal ourselves allows the person receiving palliative treatment to determine his or her own last steps. The person should get a feeling for what is good for him and for what hurts him, also mentally, and how he can deal with the pain by his own strength through mental techniques, clarified symptoms meaning self-hypnosis, meditation, breathing techniques, autogenic training, and so on. The organ language addresses consciously also the respective ego parts and explains the psychosomatic and unconsciously unfavorable way which the body and spirit, by obligations, compulsions, conditionings, entered without consideration of the soul desire. Because both the body with its ego part and the spirit with his ego part want to continue to exist here on earth. It is in their consciousness and perception that a physical dying means also a spiritual dying. Therefore, body and spirit will act against the soul and thus possibly prolong the suffering in the body. The organ language explains, defines, clarifies, and specifies the work of all involved energy body parts, body, mind, soul. The organ language does not interpret anything. It links and connects organ functions with mental and spiritual development processes. The organ language shows how the soul works through the body by means of reflex zones, meridians, organ reactions, facial diagnostics, embryology, external appearances like spots, age spots, insect bites, allergies, degenerations, emotions, and even the day of birth, gives information about the soul goal of his life and so much more that speak to us. Already after a few months, the patient had herself rechecked in the hospital. The infiltration of the peritoneum was reduced to a few millimeters, and the infiltration of the left ovary was also reduced to less than 1 centimeter. Further cancer scores also reduced to clinical picture. A palliative patient has no possibility of identifying with healthy perspectives. He is confronted again and again with his complaints. If a person comes into contact with other people, he grasps himself energetically in a certain form. He has a perception and experiences an identity. The comparison to the outside world enables a biofeedback, resonance, which creates a picture of and through himself. The sick palliative patient is often left only with the prospect of identify and resonance to the co-suffering close relative focused on dying, or with a nurse, staff, or death. Man and his mind creations, like nature, have an etheric equivalent, a pattern, that leaves an eternal impression in the surrounding atmosphere wherever men go. The pattern of each individual's activity and life experience is found within his own aura at all times. As soon as we have recognized, understood, and integrated all these creations into our existence, all negative effects disappear and man becomes healthy. But this new mental and physical structure must be maintained through discipline. The patient's improved blood results and cancer cell regression after 4 months prompted the hospital to offer her chemotherapy and removal of the ovaries after all. From a palliative discharge patient to one who was now fit for treatment and on the road to recovery, the patient agreed to chemotherapy and surgery. The patient passed the first 3 chemotherapy cycles well with the help of naturopathic treatment. Unfortunately, the cancer values did not improve significantly and further regression of the metastasis did not occur. The patient again suffered from nausea, stomach pain, loss of appetite, susceptibility to infections, and sleep was not restorative. In addition, she lost the normal weight she had previously achieved. This time was used to remove the ovaries. The chemotherapy sessions caused great side effects and poor liver values in addition to anxiety. The revival of past complaints reminded the patient of life issues that had not yet been processed. Another 3-cycle chemotherapy followed, which again severely depressed the patient and did not achieve the desired results. After the second cycle of chemotherapy, the patient became uncertain about her choice of therapy. She needed more and more alternative medical and psychological support to survive the chemotherapy. We treated the work on the different life issues secondarily because the treatment of the side effects exhausted her strength. In this way, the patient demanded a break from medical measures. With the meditation techniques, affirmations, prayers, and resumption of the vitamin-rich diet, the patient stabilized within 2 months. The symptoms could be reduced again. After 4 months of re-examination in the hospital, the metastasis had regressed in several places. Radiation was scheduled for the peritoneal metastasis, from which the patient had difficulty recovering. The body reacted to the radiation with liver metastases. Until this point, 2.5 years had passed. In summary, I would like to point out that organ language may be used to bring healing to all levels of being. Every life path enriched by organ language allows to gain something positive from life as well as from dying, and to experience death as something that continues. The dialogue between body, mind, soul is decisive for life and beyond. Thank you for listening and watching, and hope to see again.